Pfizer knew a month into the rollout into the public of this injection, so November of 2020, that this vaccine did not work to stop COVID. And I want you to process that and absorb that. It means that everything that followed, the mandates, the lost jobs, the businesses that had to close, the children not allowed to go back to school or university if they didn't take the shot, right? The armed forces compelled to take the shot, the pilots compelled. All of that that followed, the two-tier society, the suppression of liberties, was predicated on a lie. It didn't stop COVID, concluded Pfizer. The efficacy and vaccine failure. And the most common side effect of getting vaccinated is COVID. So everything that followed was a lie. Second, they knew that the injection did not stay in your deltoid. I'm sure that Europeans, probably through the EMA, the European Medicines Agency, like our FDA, or other public health entities, told people here, if you have side effects, it's likely to be chills, fever, a little fatigue. You may need to lie down. No, Pfizer knew that and they said that the materials stay in the injection site. They knew that was a lie. In fact, in the Pfizer documents, there are charts showing that the materials, the spike protein, the mRNA, the lipid nanoparticles, which is a petroleum byproduct, rather polyethylene glycol, a petroleum byproduct surrounding lipid nanoparticles, an industrial fat, they didn't stay in the deltoid. They biodistribute within 48 hours, and they leave the injection site and biodistribute to major organs throughout the body. They cross the blood-brain barrier. You may have noticed personality changes in some of your loved ones who took this injection, but they also accumulate in the liver, the adrenals, the spleen, the lymphatic system, and if you're a woman, they accumulate in your ovaries. And so this is an industrial fat accumulating in women's ovaries, right? So the first injection accumulates in your ovaries. The second injection, more accumulates in your ovaries. Our experts could not find any mechanism whereby this material left the body, male or female. So by the first booster, people are already reporting when they do surgery on vaccinated women that they're fully blocked ovaries, okay, as well as other kinds of damage. Pfizer knew that. Pfizer knew that they had to hire 2,400 full-time staff in order to process the reports of serious adverse events they were already starting to receive. And indeed, within the Pfizer documents, it's a 3-year period of time, end of November of 2020 to February of 2021. Well, that tallied up over 42,000 serious adverse events. Many individuals had multiple serious adverse events, and just an overwhelming number of side effects that were not fever and chills, but in fact, things you were not told about. So the number one side effect in the Pfizer documents is something called myalgia, which is muscle pain. How many people do you know who just feel bad? Well, Pfizer knew they would feel bad. Doctors are baffled, myalgia. The second most common side effect is joint pain, because these injections are inflammatory. And Pfizer knew that. What is arthritis? What is joint pain? Tendon pain, it's inflammatory. How many people do you know who are limping or had to have knee replacements, hip replacements, shoulder replacements? Young, healthy people, many of them. Pfizer knew. The third most common side effect, as I mentioned, is COVID. But after that, there is a catastrophic industrial scale tallying of horrifically serious side effects, notably heart damage, myocarditis, pericarditis, problems with the aortas, a great deal of blood damage, thrombotic thrombocytopenia, blood clots, lung clots, leg clots. These lipid-nanoparticles create clotting in the body. Everyone knew that about lipid nanoparticles before this mRNA who worked with them. florid neurological events. Our experts found that the lipid nanoparticles strip the myelin sheath from nerves, which is how electricity is conducted in a nerve impulse. So of course you're getting tremors. How many people do you know who now have tremors? You're getting Guillain-Barré, you're getting dementias, epilepsy type seizures, horrific neurological events. And also autoimmune disorders of all kinds, lupus type disorders, because now we know these injections damage the immune system. Also things that would surprise you, a huge amount of eye damage, blindness, eye damage of all kinds. And in addition to all of these side effects, miscarriages, I'll get into the reproductive damage, 1,200 deaths in 3 months. And these are not statistically random people who happen to have died. They were old, they had prior conditions. 1,200 deaths that doctors let Pfizer or the authorities know needed to be recorded because there was some causality they were concerned about. Other smoking guns, you call this the smoking gun. 2 of our reports show, in my view, causality. Half of the liver and the stroke serious adverse events took place 48 hours after the injection, including deaths. Pfizer knew this. Okay. Pfizer knew by April of 2021 that minors were being injured by this vaccine, specifically myocarditis and pericarditis, heart damage. Never before have we had healthy young people dropping dead on planes. But what Pfizer knew was that 35 minors had sustained heart damage. Indeed, one of the most scandalous things that our work has surfaced is that the FDA knew, the CDC knew, Dr. Walensky knew by April of 2021. The Israeli Ministry of Health was trying to tell the CDC and the Biden administration that minors were having their hearts damaged. And instead of, we did a Freedom of Information Act request for the Biden records at that time, mentioning myocarditis. And we found that there was active conversation, including to POTUS, right, surfacing all the way up potentially to the White House, 15 White House staffers, Dr. Walensky, Dr. Fauci, the head of HHS, all on these communications where they were talking about myocarditis in minors following the shot. But instead of saying, we have to pull this, we have to tell the parents of America, and by extension the world, that they must save their children and young adults from this risk, they were deciding how to spin a cover-up, and they issued a 17-page document that even after the FOIA is completely redacted, which was a script that they used to spend the next 3 months of summer telling parents to get their minors injected. And indeed, a big influencer TikTok campaign encouraging young adults and minors to get injected. And they knew that kids would sustain what is often deadly heart damage from these injections. They knew. And in fact, Senator Ron Johnson, now under this administration, is using our work to unredact those documents and to shine a light on that cover-up. He had hearings about it. Pfizer knew all of these things.